Hello, everyone. Today we have a special guest that came from Australia, from Brisbane, Australia. Here is Josh Goldberg. Hi, Josh. How are you today?
Hi, Sarah. I'm doing good. How are you? Thanks for having me on.
I'm fine. Great. Great having you with us in Israel, in the Holy Land. Tell us, Josh, what you're emphasizing in your treatment? What do you do?
So I specialize in relationship counseling,
Mhm.
and I happen to work mainly with people that are in difficult and confusing relationships.
Okay.
So they're in a relationship, and their partner and their personality might be confusing. It might be hurtful, or just basically disordered, like a personality that is very strange. And the first thing a person does is they look around for information, and that's how they find me, and they come to get counseling for themselves in how to handle their situation firstly, and secondly also to heal any emotional things that they need to heal.
Okay, and tell us, does your method helps with, let's say, anxiety during these hard times, during COVID-19? How do you give, what kind of tools do you give to your patients regarding dealing with the stress, with the anxiety that we're having today, especially in the COVID-19?
Sure. So we basically focus in three main areas. The first area is in emotions. So we teach emotional intelligence. We help the client to learn how to label their emotions effectively, how to feel their emotions, and also how to regulate their emotions, how to actually let these emotions go. A lot of people today, especially if they had difficult childhoods and they didn't learn how to handle their emotions, they get into the habit of avoiding their feelings. So many people today, they're feeling things and they're not even exactly sure of what they're feeling. And anxiety often comes out as irritation or anger, which obviously in a relationship causes a lot of problems. So the first thing we help them with is their emotions, how to label and how to handle their emotions, how to express their feelings to people that they want to connect with. And the second area is with their thinking patterns, how they see things that they've been through in the past, how they see things now, thinking patterns, and we help them to correct any distortions that they have in their thinking, which is often connected to their emotions, to their feelings. And the third area that we're now branching into is the physiology, like the balance of trace elements in the body, which plays a huge contributing factor to a person's feelings and also how they think.
Mhm. And those trace elements, okay, we do know that in areas with pollutions, I know for certain that in Israel, in a dense place like Tel Aviv, like Haifa, Bay Area, there are elements like copper. There is excess in copper sometimes. So how can we deal with that? When you see a patient, what do you suggest to do first? Should he go to the doctor, to the physician, and set an appointment and tell about his anxiety and ask about the copper excess? Or there is another way, first of all, to consult you or your associates? Can you elaborate on that?
Yeah, so I mean, look, there's no, I don't see like a one set way to handle these types of things, especially if they have things that are out of balance in their body and they're suffering with anxiety. I think a person should use whatever's available to them at the time. But the three areas that I mentioned, so dealing with the emotions, dealing with the thoughts, and balancing the body's minerals is the optimal long-term approach. But if a person needs to go to the doctor short term, if they need to get on medication, then the person should definitely get the medical help that they need, whatever situation that they're in. But long term, getting to the root of of their anxiety or whatever other emotional and mental or physical things that like symptoms that they're going through, then, you know, working on the emotions, working on the thinking patterns, and balancing the body's minerals is optimal for like a long-term result.
And how
Long-term result.
Long-term results, I see. And how do you scan usually the minerals? What is the best method? Is it a blood test? Is it by questionnaire? What do you use usually?
Well, the hair test is the hair mineral analysis test is definitely the best. The blood shows what the body is transporting. So at different times of a person's life, the body will transport things in the blood. But the hair test is the best footprint of showing the person what's actually being held in the body, right? The hair and the nails are actually like fossils, you know, how they dig up the bones and you can get information from the bones. So I've heard of many cases where a person was toxic in the mineral copper, and in their blood test, they didn't show high copper, but in their hair test, it showed elevated levels of copper because the body was storing this copper in the tissues and in some of the organs like the liver and even in the brain. And the body keeps the copper out of the bloodstream. And so on a blood test, it doesn't show the high levels of copper, whereas in the hair test, you can see the elevated copper relevant to the mineral zinc.
And do you see in your cases any elevated toxins like aluminum, heavy metals like aluminum, like mercury, like arsenic, other toxins such as, let's say, we have tin. You know, I used to eat lots of tuna fish from cans. So after a while, I saw excess of tin in my body. What do you see? What do you encounter with?
Yeah, the interesting thing with the clients that we get is that we don't see anything that's really repeating on a consistent basis. So for example, the clients that we have specifically, they often have very difficult and traumatic and stressful childhoods, like they grow up in difficult homes. So stress and this environment that they grow up in is stressful every day, and a child can't get out of their childhood home, right? They're stuck with their family, and if the family is dysfunctional or abusive or neglectful, then every day the child lives in fear and it lives in stress. So stress has a very powerful effect on the mineral zinc. Okay, zinc, it makes zinc get excreted from the body, which means that copper can then elevate.
Yeah.
And along with that, the emotional pain that a lot of our clients have from childhood, they try and deal with this pain in their teenage years with alcohol and drugs and just living an unhealthy lifestyle. And then they can not look after themselves so well. And that can also have a effect on the minerals. So you mentioned tin. So normally a person won't store tuna fish and other vegetables in a tin or an aluminium can in the fridge, because people know that that's not the right way to store things. But when someone has a difficult childhood, and that's most of our clients have childhood trauma and childhood stress, then they don't care about their health so much. So when they grow up, they don't care to put the food in a proper container. So they'll put the tuna in the tin in the fridge, and they'll drink too much, and they'll not look after their health so much. So then it causes a number of different minerals to become toxic, and also some deficiencies also. So high mercury or high tin or high aluminium for not storing food properly, because they're not looking after their health, because they are dealing with very strong emotions of anxiety or anger, rage, and, rejection, these types of painful emotions. So they don't live the healthiest lifestyle. So it can cause a whole range of imbalances in the body, which has a strong effect on their personality and on their relationships.
I see. And does the method suitable for patients that use SSRI drugs, SNRI drugs? Do you recommend to start doing the process with the pills or wait till to something happen next, like going to the doctor and share with him what you think, the thoughts of the patients? What the best method to start?
So they can do them both at the same time.
Mm-hmm.
Normally when we're seeing clients, we start off with working with their emotions first, just to try and get them back in touch with their emotions. And then we work on thinking patterns, okay, and sort out any thinking distortions, and plus go back and deal with, past trauma. And then we've found that if they're not able to implement the emotion skills and the thinking patterns and the communication skills that we're giving them, and they're going around in the same patterns, then that is usually the time that they need to go and get their hair test and find out what's happening with their body's minerals. Because if someone's physiology is creating a baseline of anxiety and it's affecting their personality, then, they need to also address what's happening inside the body. So if they're taking medication or serotonin boosters or whatever they're taking, then they can definitely do the hair test and start a vitamin program at the same time. And I think a lot of the psychotropic medications are also high in copper. A lot of them are. So if they do have a copper excess, then starting on a copper program would even help them even when they're taking the medication. So they can certainly do both at the same time.
See, and can you give us an idea what is the difference between CBT treatment and going, for example, to psychologist, the traditional way?
Oh.
So what are the differences?
Yes. So a psychologist will basically, they're able to diagnose a person. Okay. Mm-hmm. In my practice as a relationship counselor and practicing cognitive behavioral therapy, we don't diagnose a person with any specific condition or illness, mental illness or personality disorder. We look at behaviors. Okay. So in a relationship, when a person does something in a relationship, there's a certain way to relate to another person. So we only look at behaviors, okay? If someone says something, if someone expresses someone expresses how they feel to someone, there's a set way that the other person is meant to respond to that person's feelings. And if the other person has a pattern of becoming angry when someone expresses feelings to them, then this pattern of behavior is something that we can work with, but we don't diagnose any specific conditions. And we basically focus on skills and behaviors more than diagnosis and treatment. That's the main difference.
And if a person wants to start the program, wants to start the treatment, how does he do it with you? We are in COVID-19 times, as you know. The technology helps us a lot. We have evolved a lot, okay? And usually it's the treatments is sessions, it's video sessions, it's phone calls, it's you give also nutrition. What kinds of treatment is it?
So it's video sessions, mm-hmm. and normally once per week, and we give the client exercises to also practice and to implement in between sessions, okay? Because if you only have an hour with a client once a week, you can't really accomplish a lot in 1 hour. So they come on the video session and they leave the session with an exercise that they need to focus on for the next week. And if they have questions from one session to the next session, they can ask the questions in relation to their exercise. And this way they have 7 days of the week to practice the exercise and the skill that they learn. And that's how the program goes. Now, when they do the vitamin program to balance their body's minerals, they do that alongside any other emotional or thinking exercises and skills that we're developing.
I see. And how can we reach you? So I browse a little bit on your YouTube channel, your Facebook channel. It's superb. It looks very, very nice. Can you share the link? How can I reach you? How can I see your YouTube channel? What is the address?
Yeah, so the website is goldcbt.com.
Mm-hmm.
And the YouTube is Joshua and Sapora Goldberg. And on the Facebook also, I think it's GoldCBT, but it might be at Josh Sapora Goldberg.
We're going to publish also your links on the YouTube channels and also in our Spotify channel next on. And every question that the clients would have, so we're going to have your number and everything, right?
Yes.
And basically, I want to thank you for being with us.
Thank you so much for having me. It was really nice to chat about this important topic.
Thank you. Thank you. And see you.